Hey, thanks for joining Dr. Wood and I for a chat. We're talking about safe medications to take when you're pregnant or breastfeeding. We're not bulletproof, so
Correct.
as mums, you know, we can come down with illnesses and whatnot, but are there some safe medications that we can take that won't affect our baby?
There's a lot of safe medications you can take. I'll just talk about common basic ones. So it is totally safe to take Panadol. And so it's much better for you to take Panadol than it is to have a fever. So take the Panadol if you're thinking of getting a fever. It's safe to take all your asthma medication, like your inhalers and your puffers and your preventers. Right. It's much better to use those than it is to have asthma. Yeah. Common antihistamines. Okay. You know, if you get a bit of a flu, like a runny nose and you want to try to block it up, they're fine.
Hay fever.
Yeah, things you shouldn't be taking is a pseudoephedrine, right? Okay. But things like Claritine and Telfast and those other sort of non-drowsy ones are fine to take. Okay. Even the polaramines and the phenergins are also fine to take. Okay. So those antihistamines are generally fine. Right. There is an organisation called Mother's Safe, which you can look up on the internet. They've got a website and they've also got a phone number. And if you've got a question like, you know, can I take this, or can I get a spray tan, or can I go and get my hair done? Right, or even do your nails because of those chemicals. Fumes and stuff. You know, if you've got questions, I'm going to paint my house and I'm worried about the paint fumes, call Mother's Safe. They are a bunch of pharmacists. It's sponsored by the government. It's incredibly useful, and they want to give you information as you need it. So don't be afraid to call Mother's Safe if you've got a question. Also, for doctors prescribing your medication, you better let them know that you're pregnant. You know, so
or breastfeeding.
You're breastfeeding. So majority of antibiotics are safe. There are a few that are not recommended, and it'd be really important to know that if you're pregnant, So breastfeeding, likewise, majority of medications that you would normally take are fine. And now you can add things like Voltaren or Nurofen or those sort of non-steroidal anti-inflammatories. That's safe to take whilst you're breastfeeding. Okay, I didn't know. It's safe to take antibiotics again if you need it. There would be some herbal preparations out there. There's a million. Again, I'm not familiar with all of them. So if you've got any questions about that, call Mother's Safe. They'll be able to give you all the information because they know all that sort of stuff. But as a general rule,
don't suffer. Go to the GP, and see if there's something that can help you.
There are other good pain relief. If you're having problems with back pain or pubic symphysitis stuff, you need stronger painkillers. Right. They're all safe to take generally. So as a general rule, things like Nurofen is not safe to take. Yeah. Voltaren is not safe to take. That includes Sudafed. Don't use the Voltaren gels. Okay. They're not appropriate to take whilst you're pregnant.
Or breastfeeding.
But you can use it while breastfeeding. So you can use. It's confusing. Okay. Don't use the Nurofen when you're pregnant. You can use it when you're breastfeeding. Okay, good. It's a difference. Right?
Thank you so much, Dr. Wood, for those tips. I hope that's helped you.